yourself, oh. Everything go day alright. And if anybody try you, know it's gonna be on sight. See my shoulder, make you rest up on me. You know I got you, and me be your friend indeed. I'm on the money don't show now. I don't keep some for you. You know go suffer, 'cause anything I get now for me and you. For you, my friend. I know that I don't text enough, but you're always on my mind.
Well, good morning to you, my friends. Welcome to another edition of Solutions Clinic right here on the Remedy Dial Solutions 93.9. It's a beautiful Monday morning, 19 minutes gone past the hour of 10. Hope you had a great weekend, and I hope the weekend already started off great for you, or the week rather is starting off great. I mean, in a couple of days or entering December, it's going to be a period of festivity, and I hope you're gearing up for the celebrations, that are forthcoming. Well, welcome to another day to explore the world of health and educate ourselves. And like I mentioned earlier, we're going to be talking about miscarriages. We're going to be examining miscarriages and talking, all that we need to know in that regard. Welcome to the show. My name is Vic Riches. Good morning to you. Alright, we approach a sensitive but important topic today on the show. Miscarriage is a journey marked by emotional twists and turns that may face or be faced. Cycle expert, so you'll be the one to tell us if that's a myth or fact. But let's begin the conversation with, what are the causes of miscarriages in pregnancies?
Thank you very much. Painfully, I've heard of miscarriages happening as late as 7 months. Yes, 7, 8 months. I've even seen people who delivered at more than 30 weeks, and yet the child did not make it. Yes. So miscarriages actually, or the word miscarriage actually meaning loss of pregnancy before term. And term is 37 completed weeks in pregnancy. Now, when you have a miscarriage, meaning that pregnancy is lost before it's actually delivered. So there are a lot of causes. The commonest are found in its early stage, and that's in the first trimester. First trimester is first 3 months or first 13 weeks of pregnancy. And then we have various causes ranging from congenital, or not congenital, as it were, malformation, that is chromosomal anomalies rather. Yes, when we have 23 chromosomes in the X and then in one of the cells and 23 in the other one, either of the X or the Y. And when there is an incomplete one amongst this, it can lead to an incomplete formation. I don't want to go into the nitty-gritty of the embryology. People may not really understand. But one thing they should know is that there is a loss within the first 3 months, and the commonest cause, even in the first month, the commonest cause is chromosomal anomalies. As a matter of fact, about half of pregnancies lost at this stage is due to malformation. So, having said this, we also have the hormonal imbalance in the mother, in the woman. Yes, when fertility occurs, and then the hormones that are involved in maintaining pregnancy, such as estrogen and progesterone, when these two are not having proper interplay, and then they cannot sustain the pregnancy is lost. at this point. So these are commonest causes: the hormone imbalance, the chromosomal anomalies. Then we also have physical factors such as fibroid.
Okay.
Commonest among this is the fact that it may even prevent the implantation ab initio. And people use the word rock. Fibroid is like a rock. You know, the place you're supposed to implant is an fertile soil. And rather than having a fertile soil, you have a rock. Even in the Bible, they say you put your seeds on the rock, it will dry up, or the birds will eat the seed. So anything you put on the rock will not survive or not be sustainable. Some actually manage to. You know, some trees do grow on rocks, but how long can they sustain? How long can they last? So those are the causes. Physically, we have fibroids, and then at various stages, we also may have things like cervical incompetence. That's after the first trimester. You have cervical incompetence. What it simply means is that the cervix. Okay, please, at this juncture, may I tell you it is called cervix, CERVIX.
Okay.
I've had people come to me to say they were told because there is no service. And I'm like, what do you mean? There is no network. Is it MTN or what? Okay, so the cervix is not good enough to keep the pregnancy. So when the weight comes, the cervix gives way and the pregnancy drops. So those are also causes of
You mentioned spices and food ingredients. It brings me to the tweets that I saw that raised a lot of conversation. So I saw some people mentioning zobo. I saw people mentioning turmeric, ginger, etc. And these are, you know, food ingredients that also have nutritional values, as it were. So surprisingly, it's been said to cause the loss of pregnancy. How true is this?
Yes, in fact, our friend Oladapo Kunubi just came to me outside and said, I love Zobo. And I laughed. Yes, some experts have said that consumptions of these hibiscus and co in large quantities can lead to it. So now, this is the word, in large quantities. So it doesn't mean that if you say you will not eat food made of maybe ginger or turmeric, but the point is you don't get to even taste these things in food. Okay, for those of
So
you
people drink like the turmeric, they make it because turmeric is said to be a skincare whatever.
Well,
so some
that's-
people make it to drink.
at that juncture, I want to hands off because yes, I don't know why you suddenly gather things that ordinarily can purge you, ordinarily can make you feel uncomfortable, and you think that is the way. Please, hard is not the way to life. Must you take things that will cause some potential damage? Apart from even pregnancy, how about your kidneys? Those wonderful bean-shaped organs. I know one day we'll talk about kidney diseases. Those bean-shaped organs, there's a limit to what they can take. So if you're out there thinking that turmeric and ginger and garlic and co will make you lose weight, please don't lose weight and lose your kidneys along with it. Let's be careful what we consume. It's a little of those things in food, just a little. You can imagine you're cooking a pot of rice, about 12 liters or probably less than that, and then you pick just one seedling of the ginger and you slice in whatever sauce you want to use to make the jollof rice. People may not even notice, oh, you added, you know, because it's not something you
Yes.
really see. Some even blend just a little. But by the time you start consuming large volumes of those things, saying you want to use it to achieve weight loss, don't lose what you can't replace. If you lose weight, you can gain it back. But if you lose your organs, can you gain them back? No.
So they contain like high toxins that are.
No, they're not toxins. It's just that, like I said, consumption of large quantities. I've seen people chew. They tell me that in the morning they wake
Absolutely.
up, they take one whole
I've seen that
bunch
too.
of ginger, and garlic, and then they go and then they chew. Come on. Please, since you've been doing that, how much of weight have you lost? And I haven't done that. You still go and you take a bottle of Coke, and then you sit down with a bowl of rice. You're actually loading yourself with calories. So why not reduce the calorie, and then the weight will reduce? Reduce calorie, reduce frequency of consumption, then work out a bit, and let's see. If your weight doesn't reduce, then we know there's a genetic problem with you.
Somewhere.
Exactly.
Well, that's out of the way. Be reminded that we're streaming live on Facebook as well as YouTube at Solutions 939, so you can take advantage of these opportunities and send in questions if you have any, or maybe some sort of contribution or a personal experience if you want to share regarding miscarriages, and let's enlighten ourselves together. Now, you mentioned something about people losing pregnancies even at the third trimester. I'm wondering, 36 weeks is for the gestation period, I
Yes,
suppose.
yes.
So, assuming some.
Male. You're going to see the hands, it's just male. You're going to see the hands, it's just that the head will be the biggest part, but the skin is not formed yet. But at least the shape is the shape of a human. That's about 5 months, not to now talk of 36 weeks. You're just a week away from delivery. So one should be careful all the things we consume in pregnancy. As a matter of fact, I always ring to the pregnant women while I see them. There's a limit to what you can take. You don't even have the luxury of decision to say, I'm coughing, give me Septrin. Whoa. Okay, I attended to a VIP, and then she told me she reacts to penicillin. Then I'm like, wow, people like you are quite scarce. But when I see people like you, they just remind me to always ask, do you have anything you react to? I still asked somebody this morning, do you have it? And then the drug I wrote, she reacted to it, or she used to react to it. I had to quickly change. Thank God someone else checked, you see. So you still need to be careful about the things you consume in pregnancy, because they could create problems that you can't solve when it starts.
Can a woman have foresight to a possible miscarriage? Can she know that there's a potential risk of losing the baby?
Of course, there are symptoms like pain in the abdomen, lower part of the abdomen, upper part of the leg, pain in the back. Those pains, when they come up, it's a sign that okay, things are not looking good, as it were. So those are the kind of pains they experience. Apart from that, they could see some form of bleeding, spotting, and it could come as normal bleeding. Some could even tell you they're seeing blood like as if it's their period. So when things like that start happening, first things you have to do is urgent scan to check, and if you can still pick a baby and the heartbeat of the baby, then you do anything and everything you can at that point. But of course you counsel them. It has become a 50-50 situation, but try your best to see if you can save the situation.
So if a woman who experienced that sees a specialist, there's a possibility that the baby can be saved.
Yes, we've recorded tremendous successes. As a matter of fact, I remember someone now, as I speak to you, 3 times she bled, 3 times she drained water, and today she's nursing her boy. And that's the only boy she's had after 3 girls.
Oh wow! Thank God. That's a massive win. So let's talk about women who have experienced series of miscarriages. Is there a possible chance of carrying a baby to term? Because I whilst I saw that update, I saw a woman lamenting that she's had 4 miscarriages, and she's even tired of getting pregnant, as it were, because she doesn't think that her body can carry a baby.
All she needs is just a little break. I have people around me who has had such, and then we tell them, just take a break. Just take a break. It's just that the mind will just be like, let me do it. Just take a little break and try again. What it means is conception is not the challenge. Just let your body recover. Get busy with something else. I've seen people with war stories, 10, 11, 9, 8, 7, and then, they took a break, and after a while, this time around, boom, the thing sticks. Some even tell you before they knew they were pregnant, time had passed. And then, dilly-ding, dilly-dong. I remember the story of Leicester City when they won the Premier League. And then the coach kept saying, dilly-ding, dilly-dong. It was looked like a fairy tale until they won the league. So, by the time they realize they're pregnant, before you know it, 5 months, it won't be an issue.
The structural abnormalities that you mentioned,
Yes, sir.
can it be corrected?
Now, let me talk about the cervical incompetence. I have a patient who will be discharged today, and then the last pregnancy she had, the womb actually came down. Yeah, so that's uterine prolapse. And then she had the pregnancy, and then she was told to take some time out, which she took the time out. now she presented, and then she told me about the uterine prolapse and all that. I know that no two pregnancies are the same, and the experiences are not always recurrent. So I told her, I said, this is why you registered for antenatal. Let's monitor you. When we monitor you, we believe that things will come out a lot better. And then we monitored her. She came for antenatal readily. And on the D-Day, she appeared in the evening. I think it was on Saturday. Yes, Saturday. She appeared on Saturday night. And then I told the nurses, this is not the first time. I think that was the 5th she was doing. And in less than 2 hours, we had the baby. And everything went so well, like as if nothing happened. And I looked at her and I'm like, I remember how you panicked about your uterus coming down, but now you've even forgotten you went through all
that happened.
You know, so when the good news comes, you forget all the years of the bad news and all that. Now, cervical incompetence is when the cervix has lost. It's just like a rubber band that has lost its ability to be used to tie and hold things together. It has become just like a rope. What do? We have a procedure called cerclage. As early as 3 months of gestation, a cervical cerclage is applied. It's a surgical procedure applied to tie the mouth of the cervix, the lip of the cervix together to keep the pregnancy intact. And we've done this, like I said, as a matter of fact, probably maybe just one or two that we lost in the past 4 years. For those that have done cervical two, it's been a massive success. When we do cervical cerclage onwards, they will have the baby. So at 36 weeks, we loosened the rope. It was when we loosened, and then she showed up 4 days after in labor and had the baby. So it's a good one. So once it is done on time, the results are always fantastic.
Fair enough. Well, you can send in questions via WhatsApp or regular text to 0904 422 2939. 0904 422 2939. If you want to call in and ask a question on miscarriage, do that via this number 0909 888 9939 or 0912 222 2939. Someone shared a joke about this that I saw. So she said that miscarriage only happens during planned pregnancies. Unwanted pregnancies, those babies are very stubborn. They never go out.
True. I agree.
And funnily, I've never heard of any story like that.
Look, it's true. Most people will tell you, if you see people having those things, they are people who desire the pregnancy.
Right.
Now, those who are not prepared, those ones are always stubborn. And I told God, please change this narrative now, I beg. The people who they miscarry, many people who don't want them now. So if you're not ready, let it see. I don't come, sir. No worry. Let it go. And those who need the thing, let it stay, I beg. Let it go, himself. Let it go, Mo. So like, once it's 9 months, it's just like a child that climbed to the roof and say, what are you doing there? Just stay there.
Right.
When it's 9 months, you come down.
So are there age peculiarities to these things? Is age a factor to any of that?
Yes, age is a factor. More often, the older age group, that is 35 and above, experience problems with the uterus and lead to miscarriage. It's also found in the younger, like less than 20. It's also found in them, and majorly hormonal imbalance. It's commoner in both, either the extra young, if there's any word like that, and then the older than 35 years. The hormones interplay are not adequate to keep the pregnancy. And then we know that before 8 weeks, when placenta is formed, it is this corpus luteum that keeps the pregnancy preserved, and the corpus luteum is mandated to have adequate supply of estrogen and progesterone. And that's why we see a lot of times we put people on such supplements, especially the progesterone supplements in the early aspect of pregnancy, because I have seen from time when you start them on things like this and they tell you that the pain suddenly disappears. And that reminds me, oh, so this was actually waiting for the medication to stop, because if you did not start the medication, they may suddenly wake up one morning with blood stain on their underwears and boom, that's it.
All right, we have a question here. Good morning, Doc. Thank you for always sharing light on health matters. I always look forward to every Monday. I had a friend who had an ectopic pregnancy, and ever since she's not been able to conceive. I don't know what the challenge is. She's always complaining. My name is Mary.
Thank you, Mary. sorry about what happened to your friend.
What's ectopic? I don't know what
Ectopic
that
is pregnancy outside the womb. Most times, commonly, it's found in
that
the tube.
happens?
Yes, it does, sir. And when it does, they go
Wow.
through a surgery to remove that tube that housed. Some we've even seen in the ovary, the tube, the ovaries are removed on that side. This is my advice. Let her do what is called HSG. HSG is a procedure that will tell that the second tube, because a woman has two tubes that are attached to the womb,
Okay.
that the second tube is still open. So if the second tube is open, then she still has a chance at conception. If the second tube is blocked, then she might need to go for an in vitro fertilization and so on and so forth. So it's better for her, the earlier the better. She knows why the delay. Okay, yes, we need to know. And the commonest cause of ectopic is when there is a pelvic infection that slows movement through the fallopian tube to the point of implantation. It's just like saying from here to my station, I get there in 10 minutes, and then I get delay in traffic and then stopovers and all that. And by 10 minutes, I need to just insert what I have into the ground. And after 10 minutes, I have not gone through the tunnel into where my office is. I have to insert it in the tunnel. That's how ectopic happens. And boom, the tunnel bursts open because the pregnancy needs a bigger place to stay, not inside a tiny tube. And that's how ectopic happens.
So does it mean the baby can't settle
It's too small.
in the womb
so
again?
it will burst. Yes. The baby is not meant to be in the womb. It's meant to be in the womb, not in the fallopian tube that is very tiny. So it's supposed to get into the womb, in the endometrium, and implant and start growing from there.
Oh. So if the second tube is not, is there a chance where, as a result of, it being in the first tube, it affects the second one?
What can affect the second tube is if there is any form of repeated infection, or as a result of the surgery, there's something called adhesion, and then that has blocked the second tube, or there are fluids around the tube that blocks the tube. That's why I said, first things first, find out if the second tube is open. If it is, she still has a chance. I have somebody who has had two children, and is almost at term with the third one, and she has had ectopic, and now she's pregnant with that third child with one tube. So what?
Women, the Lord is your strength.
Amen. big one.
All right, good morning. My wife took in, and after some weeks, she started bleeding. We went for a scan and had two different results.
Okay.
One scan said she was pregnant, the other said she wasn't. This is coming from Tayo.
All right, Tayo, can she do a blood pregnancy test? I think that settles it. Scans can
Is it possible?
Yes, scans. It's just like saying, just like me holding this, and then I just show you the side. I cover the front, I cover the back, and I ask you what it is. You could call it a phone, but if you knew what it is earlier, you would say, "Oh, it's a remote." But of course, we have white phones, right?
Yeah.
So I show you like this, and you say, "Okay." The next you ask me is, "What kind of phone is this?" And possibly when I show you the top, you then realize, "Oh, this is a sensor. It's not a phone. Oh, it's a remote." Now, scan will show you whatever it appears to the person. It is operator dependent. But pregnancy test is not operator dependent. That tells you are either pregnant or not. And if pregnancy test is not giving you the answer you desire, just wait. Just 2 weeks. After 2 weeks, go back and repeat. There definitely will be a difference. I've seen people coming to me telling me, "Doc, I just came here to check because after this I'm going to flush the thing out, the thing." That thing, they wanted to flush out, they are nursing that thing now as a child. And then after doing the scan, I tell them, "Don't flush this thing out. Come back in 2 or 3 weeks." And by the time they come, you put the probe on their tummy. Some of them will even jump up. "Doctor, it's a baby. A baby is there. Thank you. Thank you." So do a blood pregnancy test. If it's not giving you the desired result, just wait for 2-3 weeks max. 3 weeks. Repeat the scan. You definitely will see a formed baby playing if the pregnancy is viable as at now.
All right, good morning, Doc. Are there any special treatments for women who have had miscarriages before?
Yes, I mentioned various stages and the various causes. Now, if it is hormonal if it is chromosomal anomalies, well, little or nothing can be done about it. You just try again. But when you're having a hormonal imbalance, you need to do a female hormone profile. And when it's done, it tells you, okay, the doctor will interpret the results, and whatever treatment you need will be given at that time.
No food, because there's all this cultural thing they do. You know, they put a place on a diet for us.
We have fertility enhancement medications, but of course, it's just at the discretion of the fertility expert who is assessing, and he feels, oh, this is what you need will be given. So at this point, if you have had miscarriage more than once, please, after this program, get dressed, go see your physician, and let's find out the cause. Before any form of treatment, there must be a reason. I don't just wake up and say I want to swallow paracetamol. Why am I taking paracetamol? There must be an indicated reason. So what do? Find out the cause. And when you find out the cause of what is happening to you, then you can get treatment accordingly.
All right. Well, there you have it. We've had quite an interesting conversation, and of course, I'm still taking questions, but we'll go on a quick break right now. And when we return, if you do have calls and you want to ask a question on miscarriage, do that via 0909 888 9939 or 0912 222 2939. Just stay with us. We'll be back.
Santa Claus is now right here at Solutions 93.9 FM, kids. And you can have a fantastic end of the year party also. With just 2,000 Naira, you can see Santa Claus right here. And guess what? With the same ticket, you gain entrance into Solutions 93.9 FM's annual Kiddies End of the Year party.
Party after party, after party, after party.
Parents, schools, churches, and organizations. From December 1, 2023, Santa Claus will be here with goodie bags for your kids. With this token, you can allow your kids to experience the wonders of Christmas and the pleasurable end of the year season. If you demand, we can also transfer Santa Claus to your schools, your churches, and your organizations and anywhere at a discounted rate. All you have to do is reach out to us at 100 Obafemi Awolowo Way, Aweni House, Okeado, Ibadan. Or you can contact us on 0817-452-0785 or 0818-090-5832. Solutions 93.9 FM Santa's Grotto. Let the kids breathe.
Junior, get inside. You don't want to let mosquitoes bite you, do you?